Hello everyone, welcome back. This is Dr. Mary-Zitta and we're shifting a little bit back into medicine, correct? Today we are talking about hypertension. We're going to make a series of videos, actually two, and we would focus on hypertension and touch all the important aspects that we all need to be aware of. The first video, in this first segment of the video, we will define hypertension and we will talk about the causative agents of hypertension and the risk factors that promotes the precipitation of hypertension. So stay tuned and let's get started. Okay, hello everyone, welcome back. So what is hypertension? More than half Americans suffer from high blood pressure, from hypertension. What is hypertension? How do we define it? How do we measure it? So hypertension is measured by measuring the force of the blood against the artery walls. All right, there are two main types of vessels, blood vessels. You have the arteries and the veins, period. All right. The arteries distribute oxygenated blood. The veins bring deoxygenated blood into the heart for it to get oxygenated. And the way blood gets oxygenated is when it goes through the gas exchange through the lung area. When blood comes in the right side of the body, it's deoxygenated because it has carried all, like, it's gone throughout the entire body and deposited oxygen and nutrients. So by the time it comes back, it needs reoxygenation. And we obtain the oxygenation in the lung area by breathing out CO2 and inhaling oxygen, which we need that in the blood for it to go make that trip all over again. So when the blood is leaving the left side of the body, it is now oxygenated. It has oxygen at that point. So we have that circle repeat itself all over again. So, but what makes this circle, this process of blood distribution, blood oxygenation, deoxygenation, and oxygenated again? How do we measure blood pressure? What happens? Break it down. Break it down, Dr. Zitta. All right, let me break it down for you. I did the best that I can. So when we measure the wall, the pressure of the blood against the artery wall, it gives us a sense as to whether or not the blood pressure is high in a patient. There are two numbers. Now, the baseline number is 120/70. The top number is called the systolic pressure. The bottom number is called the diastolic pressure. The top number measures the pressure of the arteries per heartbeat, while the bottom number, the diastolic number, it measures the pressure of the artery between the heartbeats. So looking at these two numbers, measuring the pressure of the artery during the heartbeats and between the heartbeats, it really gives you a really close sense as to whether or not the pressure in this person is high or low. Okay, like I said, the baseline is 120/70. That's the norm. Now, to diagnose hypertension, high blood pressure, is when the number is above 140/90. That is when there's no doubt about it that this person is hypertensive. So, but when you want to diagnose hypertension for treatment, then you're expecting to see about 140/90. Then we have a problem. We need to address this and address it right now. Then when you want to see if someone has severe hypertension or hypertensive crisis, then you start seeing that number going into 180 over 120. That is a medical emergency. That patient, if that patient is not in the hospital, that patient, you need to call 911 at that point, because there are a lot of damages that would come with that kind of a high blood pressure. And we're going to see that as we move forward. Okay, so hypertension. Let's talk about the risks of hypertension. There are several different risks for hypertension, some of which we have become mundane to us. So one of the risks of hypertension is obesity, overweight. Obesity and overweight is a causative agent for hypertension. We see lack of physical exercise, because of course if there is exercise, there's no obesity, right? So lack of exercise really, it precipitates obesity, because the heart is working harder than it ought to. And if the heart is working harder, then for how long will it continue to do so before it breaks down? So for how long will it continue to work that hard before it becomes a problem for the heart to keep working? Correct? So it's important that we regulate the stress of the heart, so that the heart is not overly stressed. And the heart becomes overly stressed when it's working against too much weight and too much fat, right, in the human body. It works harder to distribute blood. It works harder to send blood to the proper channels. When there is high salt consumption it precipitates hypertension. How does it do this? It does this by, when there is salt somewhere, it attracts water. We learned this in school, where it says water follows salt, because there's a phenomenon where there are two kinds of liquids, the one that has low concentration and the one that has high concentration. So salt is a high concentrated substance, such that when there is salt, water naturally is drawn to salt, because water fluid has to naturally leave an area of low concentration into an area of high concentration. So when you consume too much salt and you retaining salt in your body, the salt also attracts the water, which means as you're retaining salt, it's not just salt you're retaining, you're by default retaining water as well. So that's how if your diet is high in salt, that's how you can easily develop hypertension, right? There's too much fluid, and that fluid in your system, in your body, it increases the pressure against the artery walls. All right. So we also see that there is an increased risk of hypertension in people who consume a lot of alcohol, right? Because alcohol damages the heart, and if the heart is damaged, it's not functioning in its entirety, right? It's stressed, and it tries to overly compensate. And when it overly compensates, for how long do you expect that machine to keep running without damage? So when you do not consume enough of certain substances like calcium and potassium and magnesium, you also give room for your body to develop hypertension. Now let me explain potassium here a little bit. Yeah, some of you are asking, how exactly does this work? Potassium helps to balance the level of salt in a cell. So if there is less potassium, the probability, the likelihood of the cell to retain much salt, a higher amount of salt, is high. But you see that when there is a sufficient amount of potassium in that cell, it regulates how much sodium, how much salt that cell can absorb. So with a deficiency in potassium, magnesium, and calcium, the regulation of sodium in the cells is disrupted. And because it's disrupted, it retains more salt, meaning that it's retaining more liquid, more fluid. And when it's retaining more fluid, it's increasing the fluid volume in the body, and that's more force that is against the walls of the artery. Hypertension. Okay. What other precipitating factors do we have besides the magnesium, calcium, potassium? Is also vitamin D. All right. We also see stress. Stress increases. A lot of us are stressed such that we have normalized some aspects of stress in our society today. We really have. And that's not okay, because our consciousness has normalized it, but our physiology has not necessarily mastered that. All right? So that causes a problem. A lot of us don't even know whether or not we're stressed. We cannot recognize it because we've been stressed for so long that it's okay, well, that's a way of life. No, it's not. Do not be accustomed to stress, because your physique, your physiology is not necessarily adaptive to that message, right? So stress and age. Right? That's why at that point, there's certain blood pressure measurement that even though it is higher than 120 over 70, we still regard it as normal for that person. All right? We still regard it as normal for that person. So maybe that person does have a history of high blood pressure, which is high, and but they're controlling it, and then their norm is now 140 something over 80 something. That might be their norm based on their medical history, based on their weight, their size, their age, and their race. Yes, based on these factors, that could be okay. Based on whether or not this person is pregnant, is sick, has an infection, that could not also be okay. So there are different things to look at when really measuring a person's blood pressure, right? So we have all these risk factors that would cause hypertension. You also have pre-existing conditions that will cause hypertension. You have the utilization of illegal drugs, right? Like cocaine, amphetamine. All these things causes a spike in blood pressure. Caffeine, of course, it precipitates hypertension. Okay, so now medicine divides hypertension into four stages. We have the normal, which we mentioned was 120 over 70. That's stage 1. Stage 2 is pre-hypertension. That's when your blood pressure is high, but it's on the mild side of high, right? And then you have stage 1. Stage 1, which is moderate. Now, when you look at stage 1 is, now that's the third stage down, right? Stage 1 is really 130 over 80. When you are around that range, 130 over 80, that's the third stage, which is stage 1, and that's moderate hypertension. Then when you have stage 2, which is really the fourth stage, it's now categorized as a severe hypertension. Anything after that is hypertensive crisis. So severe hypertension is from 140 over 90. All right, from 140 over 90. Anything higher than that, like we mentioned, anything from 180, 125, that is hypertensive crisis. That is a medical emergency. Anything higher than 140 over 90, please make sure you're on medication. It is critical because the complications are not funny. The complications are detrimental. And again, it affects all the organ systems in the body. Hypertension does. All right. So we've talked about the risk, the definition, the risk factors, the stages of hypertension. Now let's talk about the two main types of hypertension. The two main types of hypertension include the primary hypertension and the secondary hypertension. Primary hypertension is also called essential hypertension. right? So there are two main types of hypertension, and primary and secondary. So let's talk about primary, the causes of primary hypertension. Primary hypertension is something that gradually develops. It's not sudden, right? We'll see why some hypertensive cases are sudden, why they come up so suddenly. But primary hypertension is not sudden. It develops over time. It develops over the years. That's why you see this more in mature adults, right? From like late 50s to the 60s. That's where you see primary hypertension in people who did not have hypertension prior to that age. So that is primary hypertension, all right? So let's talk about secondary hypertension. Secondary hypertension is secondary because it is not a natural process. It is either hypertension that is as a result of an underlying condition, or a medication that you're taking, or something that is not natural. That is what we classify as the causative agents of secondary hypertension, right? So let's talk about some of these causative factors of hypertension. The first one is sleep apnea, obstructive sleep apnea. When you have sleep apnea, you are not breathing systematically. There are periods where you're gasping for air. You're gasping for air, for oxygen, you run low on oxygen. So the fact that there's a period where you're running that period of drop of oxygen in your blood, it stresses the heart to function quicker. What did I say? I said initially at the start of the video that blood leaves the right side of the body, goes through the gas exchange area into the left side, and then from the left side it goes through the aorta and goes to the rest of the body. So if the rest of the body and the tissues and the organs are not receiving enough oxygen, message is sent to the heart because they are sensors. Yeah, the body is automatic. They are sensors, right? So the brain, the body, the heart, it all sends all of that message. The kidney, they all communicate, right? So as soon as the tissues know, okay, we're expecting this amount of oxygen and we're not getting it, the heart now needs to compensate for that. And by compensating, the heart is overworking. When the heart overworks, the heart becomes stressed. The heart becomes stressed, it's overworking, it modifies its structure. And all of these modifications, because of stress, is not good for the heart. And that results to hypertension. Okay? All right. Another causative agent for secondary hypertension is kidney disease. Why is this important? Kidney disease is usually, I'll just pick one because there are different kinds of kidney diseases. Let me talk about the narrowing of the arteries of the renal artery. It's also called the renal artery stenosis, which means there's a narrowing, stenose, it's not at its normal size. So if there's a narrowing of the renal artery, the arteries in the kidneys, it becomes a problem. Why? Because the sensors, all right, the cells that sense this kind of insufficient fluid, insufficient blood, right? And so when the kidney senses that, it forces the kidney to turn on something known as the angiotensin system. When it turns that on, it means it's trying to produce more fluid because it does not know why the heart did not send enough. But if the heart did not send enough blood, or if the heart sent enough blood, but the kidney is just not receiving it because the artery that was supposed to receive the blood that was coming from the heart is narrowed, the kidney just knows that I don't have enough blood. So if I don't have enough blood, it means that the heart does not have enough blood. So what I'm going to do is I'm going to stimulate these hormones. I'm going to stimulate this system, this endocrinological system, all right? I'm going to stimulate it to produce more water, to make more salt, so that we retain more water, so that the body has enough fluid, enough blood. So that's how, if there's a narrowing of the arteries of the kidneys, all right, the renal arteries, it could precipitate hypertension through the stimulation of hormone productions that causes for fluid retention in the human body. Okay, so that's how kidney problems, kidney diseases can precipitate hypertension in patients. So let's look at the tumors in the adrenal gland. If there's a tumor will press against structures, and the pressing against structures will send negative feedbacks that would stimulate the production of something called aldosterone. It's another kind of hormone. Aldosterone also is like, we need to produce more water because the system needs more fluid, because the system needs more blood, right? So when there's a tumor in the adrenal, organ, it precipitates a production of aldosterone. Aldosterone is, we're producing more water, we need more water, and so that's as simple as I can explain that. Aldosterone will make sure that there is more salt retention, and salt retention means that there's going to be water retention eventually, and water retention means there's more fluid in the body. Then, the body's retaining more fluid, and of course that adds on the stress of the body, right? We see a very similar phenomenon in thyroid problems. When you have thyroid problems, the thyroid is overactivated. When the thyroid is overactivated, it secretes stuff and substances that makes the heart overactivate, because that's why you see in hyperthyroidism, which we will talk about, hyperthyroidism, the heart rate is high, because the sensors from the thyroid, it either slows down the heart rate or increases the heart rate. So that's why in hyperthyroidism, the heart rate is increased. In hypothyroidism, the heart rate is decreased. So if you have hyperthyroidism, it stimulates the heart rate to act quicker and fast. It puts stress on the heart. And when there's stress on the heart, the likelihood of that heart to be damaged is very probable. And when the heart is damaged, the heart is not functioning in a way that fluid is easily expelled from the body, and we have hypertension. The heart is stressed, the heart muscles up, it becomes enlarging, and there's greater chance for heart failure. And when there's heart failure, heart failure means the heart is not functioning properly, and therefore fluids are not being distributed the way they ought to, and the heart fails with hypertension as one of its sequential effects. In children, when you have hypertension in children, usually it means that there's a congenital disease of the heart or the kidneys that is precipitating hypertension in children. All right? What other kind of medications, what other causes do we see in secondary hypertension? We see medications like illegal drug use, like cocaine, amphetamine, they precipitate hypertension. We also see that birth controls can also precipitate. It doesn't necessarily always do it, but it could too. So when you're on birth control and you never had experienced hypertension before, it's worth mentioning it to your physician that, hey, I'm having this, So just for your own knowledge, you keep an eye on that, okay? All right. So some cold remedies as well, like some over-the-counter cold medications, can also precipitate hypertension. All right. So if you're taking that and you feel like your heart is almost jumping out of its chest, you want to take your blood pressure at home, monitor yourself, and then see how you can communicate this with your physician. Because if it does that, then you want to try something else that's not as strong for you. All right. You also want to make sure that there are some prescription medications that could cause that as a sequential effect, as a side effect. But all of these things, when you notice them, just communicate them with your physicians and let them see how to manage it. But usually if it's a secondary substance that you take in, right, that causes you to have hypertension, usually to treat that, you just remove that causative agent and you'll be fine. And if it's a pre-existing condition, then managing the hypertension is not necessarily doing you any good. How about we take care of the problem and not just treating the symptom, all right? So if you have an underlying problem, say like kidney problems, and the effect down the line is hypertension, let's focus on that kidney problem. Because when we fix it, the high blood pressure will take care of itself. So please communicate these things to your physician and figure out with them what the best course of action is. But you have to visit with your physician, especially when you have hypertension. Like I said, the after effects, right? The complications are not pretty. Which brings us to the end of this video right now. And in the next video, we will talk about the complications and treatment of hypertension. and also talk about hypertension in pregnancy. So I hope you stay tuned. See you in the next video. Goodbye.